in response to some of the emerging biology, the genome, for example, of for myeloma was just characterized and published in 2011. And that was a collaborative work amongst industry scientists, the Broad Institute, MMRF, a number of, you can see that reflected in the authorship of the paper. And in response to that, the CoMMpass study was developed to enroll initially up to 1,000 patients who were newly diagnosed, who were newly diagnosed with multiple myeloma, who were to receive a proteasome inhibitor and an IMiD, so two classes of drugs that are commonly used. And the idea was to, at different time points, starting before treatment started and throughout the course of treatment, and even if the patient relapsed, to sample the tumor, so do a bone marrow, look at the plasma cells, and see how the characteristics of that myeloma clone are changing. So really to characterize what is going on with the tumor. This has never been done in such a scale before and with such advanced technology. But before that, in addition to the genomics and the specialized testing that we're doing that is still somewhat exploratory, there's also a complete annotation of the patient, their demographics, they respond to quality of life, questionnaires, besides all the physical and laboratory information that routinely would be collected. All of that is entered into the database. It is such a comprehensive assessment done prospectively so that we'll know how are these tumors changing when they relapse. And as the doctors maybe initiate other treatments at the time of relapse, how are some genomic clones responding versus others? And we'll understand that better. So I think it's the numbers of patients, the international input. Now there are investigators from Italy and Spain, at least that I know of, that are contributing information. Besides that, a fundamental feature is open access of data. Data is shared. It's put up on their website. There's certain access restrictions to researchers, and then patients can also access and ask questions. And it's shared with us, say, our translational medicine group, quarterly, and we can look at it, form questions in our mind to go back to the steering committee for the study and say, have you thought about this? Have you thought about that? Or we see this as being entered. And to my knowledge, there's really nothing of that scale that's precedented. And this is advocacy influence, trying to make all the data out in the open for patients. It's getting to be a regulatory mandate as well, but you know, for a long time people have been very protective of their data, and that collaboration, I think, can only be for the benefit of patients. It's also made patients more interested in submitting samples for this kind of research, and we're really thankful that they are. But that, to me, is a really fantastic initiative.